Today I'm going to talk you through the summative assessment tasks for physiotherapy assessment, clinical reasoning and decision making module. So if we go to the assessment information and submission, this is where it takes us to, into the summative assessment folder. So in here we've got the brief and we have the different case studies. So later on in the module we will release an allocation of here of which case study you've been given. This time it's an individual case study, so rather than you working as a group, you'll be given your own separate case study here, and the information on them is in there. So I'm going to go into the summative assessment brief. Okay, so what it explains to you is the module has two assessment tasks. One is a presentation and one is your placement. So task 1, we've got presentation that's up to 20 minutes long, and this is assessing learning outcome 1 and 2. So you're going to be preparing a case study presentation, 15 to 20 minutes, identifying and explaining the main factors that you consider when undertaking a holistic assessment. Things like the environment, cognitive ability, the MDT approach, patient-centred care. You'll be expected to articulate your approach to clinical reasoning and decision making with reference to theories, concepts and methods that underpin physio practice. You should use this information to help you justify a problem list and also identify some goals and an approach to treatment planning. Your presentation could use any electronic format, but please make sure with the module leader, myself, that we can display it. Okay. So task 2 is your placement, and this is assessing learning outcome 3 and 4. You'll undertake a 6-week clinical placement in an NHS or private health and social care setting, and you'll be expected to demonstrate core healthcare values and communicate with service users, carers and the MDT. You also need to comply with policy and within the department and demonstrate basic assessment and clinical reasoning skills. You'll record this on PebblePad in Portfolio. So the learning outcomes for the module are: number 1, identify and explain the process of physio assessment and the factors which contribute to this. Number 2, justify problem identification, goal setting, treatment planning through the use of a recognised clinical reasoning model. So those are your presentation learning outcomes. Number 3 and 4 related to placement. Demonstrate effective communication skills through application of assessment, clinical reasoning, decision making within your scope of practice. Also demonstrate core healthcare values and adhere to policies and procedure. So we'll be allocating marks for your presentation against the generic marking grid. So for subject knowledge and understanding, you need to be demonstrating a level of subject knowledge about the role of clinical reason decision making in healthcare, refer to appropriate models or approaches to clinical reasoning, use core text and appropriate literature to support your discussion. For the intellectual skills part, we need you to demonstrate an ability to develop and apply ideas through discussion of key factors that you've considered with respect to the case study. Identify how these have informed your clinical reasoning. For the subject-specific skills, we want you to identify and explain the problem list that you've developed and also discuss treatment goals and how you would manage those. For transferable skills, this includes your presentation, how you deliver it, so how it is visually and how you deliver it verbally, and also that you've followed all the guidance. The weighting of the module is task 1 is 40% of the module mark and task 2 is 60%, and you must get 40% to pass the module. So a little bit more information here on the layout of the presentation. We're saying it needs to be up to 20 minutes, suggested 15 to 20, no more than 6 or 7 slides, excluding your front cover and your references. Front slide would be similar to what you put on a front cover of an assignment. Slide 1, the case study information. Slide 2, the factors influencing assessment, clinical reasoning, decision making. Slide 3, a problem list. Slide 4, treatment goals. Slide 5, a treatment plan. And slide 6, your references. There's a separate screencast about the formative assessment. And then this is just talking to you about the marking. So each of the learning outcomes are evenly weighted. The overall percentages, so task 1 is 40%, task 2 is 60%, as I mentioned before. Task 1 will give you audio feedback 15 working days after submission. Task 2, you'll have face-to-face formative and summative feedback on your performance in the placement. So hopefully that's helpful, and there will be an assignment support session as part of the module.